This is Dr. Melanie Palm from Art of Skin MD, and today I bring to you QWO, the first FDA-approved injectable for treating cellulite on the buttock. We are so excited to have a new little friend in our injectable world here at Art of Skin MD. This is Dr. Melanie Palm, and I am here to debut QWO, which is the first injectable that is FDA approved to treat moderate to severe cellulite in the buttocks. We have a perfect candidate here today. So I wanted to show a couple things. I want to show markings, which I think is perhaps the most important sort of criteria and step that we do in the treatment process, in addition to patient selection. So we want somebody that truly has just dimple-like cellulite, doesn't have a lot of skin laxity, and we're targeting the buttock tissue on this treatment. So this lovely patient, I am going to have her sort of move her little tushy. Will you flex for us? And we can see areas where she has had dimple-like cellulite. Probably she can remember since she was younger. And that's an important question to sort of ask patients. And you can relax again. So I've actually marked this side. I think it's really helpful. We have standardized photos. I think that's super important for successful treatment so patients can actually see the results. And then I actually use these photos to match up what I'm seeing sort of in real life. So I've marked 12 dimples over here. We're going to mark 12 over here. We can treat 24 total in a buttock in treatment. That's what's actually in the larger 1.84 milligram sort of pack that we get together that completes a buttock treatment. And we're going to do it 3 times. So it's once every 21 days, basically every 3 weeks. And we're going to do it 3 times, and we see an incredible smoothing in the skin. How does this work? It's collagenase. So collagenase is an enzyme that breaks down collagen. And what's causing these little dimples are fibrous septae, or strong collagen bands that are pulling down on the undersurface of the skin. So we're going to use a little enzyme, inject it there, be able to sort of snip, snip, snip enzymatically some of these areas, lift up that fibrous band, have new healthy collagen remodel and build in through a process called enzymatic subcision and remodeling, or ESR, and we're going to create a smoother skin envelope over time because no one wants these dimples. This is a beautiful, beautiful backside, but I know that she's bothered by some of these dimples. So I'm going to finish up marking, and then we're actually going to show treatment in the next step. I wanted to give you a quick preview of what marking actually looks like. Now that you've seen markings from the right side of the buttock, I'm actually going to do markings on the left side of the buttock. Patient selection is key with QWO, so you want to pick someone with good skin elasticity but has dimple-like cellulite on the buttock that is moderate to severe in severity. And so what you can see I'm doing, I'm comparing baseline photographs that we took in our photography suite, and I'm comparing that to the patient actually there standing in front of me. And not only am I marking things at rest, but I'm also confirming them periodically through assessment while she's actually clenching her gluteus muscles. That really accentuates some of these buttock dimples. Once I'm done, I count them up. We can treat up to 12 dimples per side on the buttock per the FDA indication of QWO. QWO is collagenase type 1 and 3, and it helps reduce the fibrous septae or collagen bands that cause this dimple-like cellulite on the buttocks. Let's get ready for treatment. Okay, now we're at step 2 of our QWO injection. So just as a reminder, this is for moderate to severe cellulite. We want patients with basically little to no laxity, but just these discrete dimples that they're telling us about. So the pack of QWO actually comes prepared as a powder. So here's the powder, and then a diluent, which we're actually going to use to mix into the powder to make it into a solution. So this is type 1 and type 3 collagen. They're called OX1 and OX2. These are our structural collagen that are composing these fibrous septae or fibrous bands that are pulling down on the undersurface of the skin. So we're going to inject it just with a pretty simple procedure. We're going to inject each one of these with 0.3 cc's, and there's actually 3 points I'm doing. So I'm going to go all the way down and inject 0.1 cc, and then I'm going to head and sort of redirect towards her head and put 0.1 cc's of the QWO there, and then I'm going to redirect towards her feet and actually inject 0.1. So each of these is receiving 0.3 cc's of QWO. We can treat up to 12 lesions per side. That's 24 of these cellulite dimples. So I'm going to show a couple. You can see I've cleansed off this side. The markings are a little bit lighter. It's really important, clean skin before we're injecting. And then what to expect afterwards. Definitely some moderate bruising. So we tell patients you could be eggplant purple for up to a couple weeks after treatment. But what's interesting is though it looks dramatic, it doesn't hurt. So I think that's really important to kind of prepare patients for. It's not really uncomfortable. Patients typically say that the treatment is really easy, and although it looks a little bit silly, it's an easy treatment at home afterwards. So I actually want to inject that. So here's one of my dimples. I'm going to go through the little marked point, and I'm injecting 0.1 straight down. I'm going to redirect 0.1 towards her head, 0.1 towards her feet, and that's one. And then it's just this simple. So I think the biggest thing is just patient selection. We want to pick the right patient. After that, we want to pick the right spots, and I think photography is really important for actually doing that. And then after we've selected the right dimples, it's pretty straightforward, but I think there is some technique involved in actually injecting it, this 0.1 in each of these areas, and making sure we're redirecting the needle correctly. So those are 3 dimples that have been treated. I'm going to continue on. That's QWO. If you have any questions, you can call us at Art of Skin MD. It's 858-792-7546. Look us up on our website. It's artofskinmd.com. We've got all sorts of amazing information on QWO on our website and on our blog. Thanks so much.